Hello, am I audible and visible? Okay, let's wait for everyone. Hello. Sure, sure, doctor. I will share the tips, all of the tips. Sure, between the paper one, paper two, I will share everything. I will share, right? Okay, just waiting for the joiners. Everyone will be joined, then we will start this session. Okay, so let's start this session. My name is Dr. Vaibhav Ahuja. I'm graduate from International Higher School of Medicine, Bishkek, Kyrgyzstan. My batch was 2015 to 2021, right? And I cleared my FMG recently in December 2021 only, with the score of 166 in the first attempt only. And yeah, now I'm working as a intern in SGMH Hospital Jaipur, and working in the AHMC college as a ophthalmology faculty, right? Assistant Professor of Ophthalmology. And I started this group Target 200 plus to the help out the FMGs, because as I'm seeing there is no one to help out the FMGs. So I started this group just for the help, right? And I was also not knowing that I can do as much as I did, right? I don't know how to create the quizzes and all. I learned this thing, how to create the quizzes from the questions and all everything, and how to post the questions, how to manage this all everything. I learn, and I was doing with the parallelly with my daily schedule, like OPDs and internship and college lectures and everything, right? So now is the day. Tomorrow you have the exam. I was waiting for this day, and you also was waiting, right? And I know everyone did best. You given your 100% to this exam, I'm pretty sure, and surely you given your 100, right? And you will clear this exam clearly. Surely, I am damn sure that you clear this exam 100%. Just some tips and tricks I want to share with you for the examination day. And about this, like, you have exam tomorrow, so please try to sleep today near the 11 o'clock. 11 or 11:30 is the maximum, or 12. After the 12 it's not good. Before 12 you have to sleep, right? Because you need the proper sleep. Okay, you need the proper sleep. So please sleep before the 12 only. And the main thing, please take light food in the night. Don't take any heavy foods and everything, because you are traveling, or maybe you will travel anywhere or other hotels and all this thing, because you have centers far from your house. So please take very light food in the night also. Don't take heavy foods. Okay, take your proper sleep, wake up in the morning 6 o'clock, and then uh, you have to go to the your center before the 7 o'clock, right? Reach there 7 or 7:30, because the last time, or to the enter this room, it's the, I think 8:30, right? Or maybe 9, right? So please don't be late. Okay, they will not allow you after the closing the time. So please try to be on the time only. Okay, don't be late. Then go to there, give your first exam. After, what to do for the paper one, it's the important thing. For the paper one, you will get many questions from the PSM subject. So please revise the PSM subject very well. Okay, you need to revise your PSM subject with the images, because PSM are coming with the more images. So please revise the PSM and FMT with the images. You have to revise this main subject and other like pharma, because pharma is like a volatile subject, so you have to revise the pharma subject also, na? So revise the pharma subject and this all in the paper 1 in the morning only. Okay, in the morning you revise this everything and go for the paper 1. Please carry your original documents. Don't do such things like you are carrying the photocopies of your documents or the pictures, mobile pictures, right? Don't do such things. Please carry your original documents like passport, PAN card, Aadhaar card, or driving license, or the voter ID. You can choose anyone you can carry which you applied at the time of application. Please carry that one only. Okay, carry that one. The important is, if you have the passport, carry the passport. It's the better for the every FMG, right? Please carry the passport, it's better for you. Then carry the 2 or maybe 1 copy, colored copy. If you can do the color copies of admit card, carry the color copy. Okay, because in the color copy your pictures were very clear, so they will identify or verify you very quickly, right? They will not take don't take such more time to verify you. Okay, so take that copies. Okay, and please fill that that COVID e-pass which are behind this admit card. Okay, please fill that part also. Okay, and then go to the examination. Don't be afraid, don't be afraid. Anxiety नहीं होनी चाहिए. This is the important thing. अगर anxious हो गए, you will decrease your performance, and if you decrease your performance, it's not better. Okay, it's not will be good. Okay, so don't be anxious. Okay, chill mood से जाना है, आराम से, and be confident. ठीक है, confidence level low नहीं होना चाहिए. Please be motivated and be confident that you read very well, you did very well in last 6 months or last 1 year. You did your 100%. Now it's the time to show how much you did. Okay, so don't think so much. And the one thing which I am getting more and more queries from the every FMG, that sir, when we are going to the exam, so we are thinking about the results कि रिजल्ट्स क्या होंगे, राइट? आई हैव डोंट, मेरे को मिस्टेक्स नहीं करनी है, रिजल्ट्स क्या होंगे, रिजल्ट्स क्या होंगे. सो डोंट थिंक अबाउट द रिजल्ट. ठीक है, डोंट थिंक अबाउट द रिजल्ट. इफ यू थिंकिंग अबाउट द रिजल्ट्स, ठीक है, सो इट विल गिव यू सम एंजाइटी एंड इट विल नॉट गुड. ओके, just think, yeah, I did very well, and I know that much that I can clear this exam and give your exam very well. Okay, so you complete your first part very well, because there is all the paraclinical subjects like anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, and FMT and PSM only, right? So give your this part, and after this part you are coming to the for the break. In break time, what you have to do, please listen carefully. No one talk with anyone about the paper 1. पेपर 1 के बारे में बात ही नहीं करनी है. क्या हुआ, कौन से क्वेश्चन का क्या आंसर था, कुछ भी बात नहीं करनी है. ओके, विच यू गिवन ऑलरेडी, डोंट थिंक अबाउट इट. उसके बारे में कुछ बात नहीं करनी है. डोंट यूज एनी टेलीग्राम एट दैट टाइम. I saw this thing, some telegram groups are there, they will ask you which question came, and you are replying there, right? This question came. Don't do such things. I also close my group also. Tomorrow morning 6 o'clock I will close the group to the messaging, and I will open this after 5 o'clock. Okay, after the exam. So don't message in any group that this question came, answer was this. Don't do such thing. Not किसी से बात नहीं करनी है about the paper 1. ठीक है, you give the paper 1, come back in the break time, take a little bit. Okay, बिल्कुल light वाला lunch, you can take some little bit lunch. Okay, and after the lunch just start to revise the radiology images, important one, because radiology is coming the part 2. Radiology images, surgery images, and the obs and gynae images. Or you can do, which is your weak subject for the part 2, you can do the revision of that part also. Okay, so revise that part, and after the revision go for the part 2 also. Okay, and don't do such silly mistakes which I am getting. I get so much query, so I will read about this. They will ask you such things, so I will clear the queries. Like they are asking, we have to carry our original ID card. Yes, you have to carry your original ID card. Don't carry any photocopies or any copies of the ID, carry your original ID card only, right? Carry your original ID card, okay? And don't be late. Again the same thing, he's asking that sir, if I'm getting late 10 minutes or 20 minutes, they will allow. No, they will not allow. Please reach the center before 1 hour. I'm giving you this advice, 1 hour पहले ही पहुंच जाओ, it will be beneficial for you, okay? Because you have some centers in the outer of the city. All the centers, I think maximum centers are the outer of the city, right? So city से travel करके जाना उधर तक, it's quite bit hard, right? So जल्दी से जल्दी till there, please reach till 7 o'clock or 7:30, right? The next thing, yeah, the important thing, please, if you are already like asthmatic patient or you have the migraine problem, anything, so please carry that. Yeah, I will tell you, please carry that medication which is your already you are going on with, right? So take the proper medication, like some have the diabetes or someone have the migraine problem or someone have the asthmatic problem. So please carry your local medications which you are taking. Take that one medication, it will be good for you, right? The next thing is in the break time, don't use mobile phone, okay? Try to learn from the notes revise karo, images revise karo. Don't use mobile phone. If you are wasting your time in the mobile phone, it will be not good, okay? The next thing, don't wear any jewelry, right? Like boys wearing kada and this chains and all. Don't wear such thing. And about the girls, don't wear that earrings, rings and nose pin and all things. ये सब कुछ नहीं पहनना, because they will not allow you with this, okay? So please don't wear such things, okay? And the next thing, in the break I already told you what to do, and now we are talking about the exam. So what to do in the exam? You will you will go and sit properly, okay? And because in the June time you have the it's the summer time, so be hydrated, because there will be no AC in the examination hall, okay? So be hydrated and drink properly water and take sleep, I think 6 to 7 hours sleep before the exam, okay? The next thing, the main thing which I want to tell you, please don't change any question, any answer, okay? This is the main thing. Like Dr. Divya is asking, sir, last moment पर कुछ answers change करने के attempt को कैसे रोकना चाहिए, right? I did this mistake last time and around 10 to 10 question, and my first answer was I selected was the right one, okay? And got stuck at the 146. So what to do about this, okay? How to control this, okay? So what to do about this? You have to go with the numbering, okay? Solve your question with the numbering, like 1 2 3 4 5, ऐसे 1 by 1 जाना है, ठीक है? Answer, mark your answer at that time only. उसी टाइम आंसर मार्क कर देना है, which one is your pretty sure, right? And I know this thing, if you learn this all the subjects, I think everyone learn maximum 12 13 14 subjects सबने किए हैं, right? So don't think, ऐसा भी नहीं सोचना है कि ये क्वेश्चन किस सब्जेक्ट से आ गया, आई एम नॉट गेटिंग दिस थिंग, कि किस क्वेश्चन से किस सब्जेक्ट से आया है, मुझे तो समझ ही नहीं आ रहा है. इफ सच क्वेश्चंस आर कमिंग, दे विल डीमोटिवेट यू. एंड आई एम प्रेटी श्योर जो स्टार्टिंग के 1 to 10 क्वेश्चन होते हैं, दे आर मैक्सिममली हार्ड क्वेश्चन, है ना, एंड दे विल डीमोटिवेट यू दैट यू डोंट नो एनीथिंग. एंड अगर ऐसा कुछ आता है माइंड में, यू डोंट नो एनीथिंग, प्लीज ऐसा कुछ मत आने देना. गो विद द फ्लो, ठीक है, कोई बात नहीं. Choose, mark any answer, and if you are having confusion in any answer, so mark as a flag, okay? उसको mark as a flag कर देना है, because we will recheck this answer if we getting time in the last moment, okay? Last में अगर हमारे पास time बचेगा, so we will check this, okay? But at that time you have to mark the answer. उसको blank नहीं छोड़ना है, you have to mark the answer, okay? And I'm pretty, मुझे इतनी श्योरिटी है, when I was giving the FMG exam and you learn this subject, so after the seeing the question and the option, in your subconscious mind you have the answer, surely, right? कि आंसर इसका ये होगा. But now what you are doing, you are reading again and again question and again option, and you are getting in the confusion, and you are creating the confusion. Like this answer will be right or that answer will be right, and you are making yourself in a confusion. So don't do such thing. If you are reading the question and you are sure that answer is this, mark that question and go to the next question. Don't be confused in that question. And the next thing, if you are getting time in the last 10 minutes or 20 minutes, don't recheck your paper. Just check this thing, how much there is a showing the count, how much is the correct how much you attempted the question. So attempt every question, ठीक है, attempt 150 question in the part 1, 150 in the part 2. Don't leave any question blank. Okay, choose any option which is जो भी तुम्हें अच्छा लग रहा है, right? Choose that one, but छोड़ना नहीं किसी भी क्वेश्चन को, right? And don't recheck, किसी भी टाइम पे recheck नहीं करना. If you are checking again, you will surely confuse, and then you will change the answers. So answers change कब होंगे? When you get the time and you are checking this thing. अगर टाइम मिल रहा है, सो जाओ. I will say this thing. Take sleep, 10 minutes, 20 minutes, quick nap ले लो. Don't check again. वापस पीछे जा करके again you are seeing the question and you are correcting that question. That will be a disaster. Okay, like Divya Darshwal is saying, last time she changed the 10 to 12 questions and she stuck at the 146. The same was with my many friends, and the same thing was happened with me. I changed near the 21 questions, and out of 21 questions I got wrong 18 questions after the changing the answer. If I was not changing the answer, my 18 question was the right. Okay, so don't change the answers at the last moment पे कोई answers change नहीं करने हैं, which you marked at the first time. Your subconscious mind is saying that B is the option, mark as a B and move forward. Okay, did you understand? If you have any queries, you can ask now. If you have any queries, you can ask now. Any queries? I can understand Dr. Satyendra Chaudhary, but you have to, right? About the motivation I am talking now, you already did very well, Dr. Satyendra, and everyone I know, you did your best, you studied well, you studied all the subjects. Please don't think about this. I am getting more and more queries in my board. Sir, I did only 12 subjects. Sir, I did only 15 subjects. Sir, I did only 10 subjects. So how much you did, you did the perfect, right? So you can score in that subject as much as more, right? So don't think about that you left any subject. I'm getting questions, I'm getting queries like, sir, I left the medicine subject, I left the radio subject, I left the orthopedics, I left the psychiatry. So don't think about which you left, but which you covered. Please try to that on that subject you will get more and more marks. Try to get the good marks in that subject which you completed. Okay, complete that subject, it will be good. Okay, जो subjects हो चुके हैं उसको अच्छे से करना है, right? And give your tests very well. You will surely we will pass. I know every FMG have that much potential to clear this exam easily. And these are the screening tests. They are not asking you about the ranking and all things. So you can clear this exam easily. Just you need the 150 score. And the main thing, don't think just you need only the 150. Don't work for the 150. I am saying this from the 22nd of the January when I created this group. I named this group as a target 200 plus. You can see this, the logo, and you can remember this logo in the exam also, that our target is the 200. Okay, so you have to work for the 200, and you worked for the 200, and you will surely get the more than 200, right? So बिल्कुल भी नहीं सोचना है. Give your best. Okay, give your best. You will surely clear this thing. Okay, and about okay, clear करना है इस एग्जाम को, and I need your messages after the exam that how much my this image session, this questions, this quizzes, and how my group is helped out you. We will talk after the exam only. Okay, doctor? That Dr. Divya is saying yes, thank you so much doctor for efforts. Sir, मुझे अभी वो वाले MCQs गलत हो रहे हैं which I used to do very well. What should I do? I am going into anxiety. Anxiety नहीं करनी है doctor. If you are be anxious, your performance will be low. So anxiety नहीं होनी चाहिए. I am saying again and again this same thing कि anxiety होगी, you will get low performance and it will be not good. Okay, so don't think so much. Please take 5 to 10 minutes break and then try to solve that MCQs which was you are doing well, right? You are doing well, right? But now you are getting wrong. Okay, so take the rest and again try to do, and don't be anxious. Okay, don't think about the results. If you are thinking about the result, you will get the anxiety surely, and anxiety will not good. Okay, don't think about the results and don't do overthinking. That I will choose this option, so what will be happen? I will choose this option, so what will be happen? And I'm giving you such tricks it is the last trick for you and the last talk with you. And when you are going to the exam and you are seeing the very big question of the clinical case and you are getting afraid that ye kya aa gaya, right? And you are totally depressed, like how to learn and how to find the key points and everything. So what to do? Please start the question from the options. Okay, when you're reading the options, you read the option like एनाटॉमी का क्वेश्चन दिया हुआ है या फिर मेडिसिन, लाइक द सर्जरी क्वेश्चन इज देयर. ओके, दे विल गिवन यू अ वेरी बिग हिस्ट्री ऑफ द पेशेंट and one image is there, so you started the learn about this, you started read the question from the options. So when you read the options, you get like indirect hernia, direct hernia, hydrocele and varicocele. So you get to know that this question are coming from the surgery subject. Okay, so what will be happen, your all mind will be open your surgery notes. Okay, you will getting into the surgery note. Yeah, I saw the hydrocele, I saw the varicocele, I saw the direct hernia, I saw the indirect hernia. Okay, so you will go to that part and then try to read out this history fastly. When you are reading out this history and you see the image, you will get to know that you will have to compare this thing. Like they given you that when the patient is coughing, that hernia is going, that part that protruded, it's going inside, right? That type of the keywords are surely given there. Every clinical question have 4 to 5 key points are there. You have to catch only 1 or 2 key points and you will sure that answer will be this. Okay, so try to use this trick and you will surely get to correct the answer about the big and big questions. What about the small and one-liners question? Read out the question, read out the option and surely you will get easily the answers and you will clear about the one-liners. Okay, hi sir, whenever if I read a question, when I can see one option after getting C, it can be wrong, is it there? I didn't get your point. Whenever if we reading a question, when can see one option after again seeing it can be wrong, is there? Just read the question and your subconscious mind, if you are saying that this option is correct, try to choose that. Okay, try to choose that. If you are sure confirmly 100% that this is the answer, mark the answer and move forward. But if you are confusion in that, so listen about your subconscious mind. Okay, you listen your subconscious mind, mark that one. And if you are confusing with the options, like some big questions are from the PSM about this epidemiology or the vaccines and all, so you can mark the answer which you are thinking and you can leave as a flag. Okay, there, but you have to mark the answer. Please don't leave without the putting the answer. If you are doing this, it will be not attempted. Okay, so attempt the question and leave a flag there, so you can if you are getting the time in the last, so you can come back and solve that questions. Okay, and think about that question. Did you understand? Any other queries? क्या प्लीज़ हमसे जो रिसेंटली नीट पीजी का एग्ज़ाम हुआ है उससे थोड़ा सा प्रैक्टिस करवा सकते हैं, लाइक क्विज और समथिंग वॉट एवर. The NEET PG questions are totally different, so don't think about the NEET PG question, right? I am sending you the FMG level questions, so try to practice with that questions only. Okay, when you are learning with the FMG level is totally nowadays near the NEET PG level. I am not saying this the level are totally different, but the FMG is a screening test, so they will ask you some points. They will not ask you about the diagnosis, they will not ask you about the treatment part, that which drug you will prescribe and this all the things. Just they will ask you some tricky questions for the clearing this screening exam. I got 149 last time. I'm scared I might do the same mistake, overthinking this time. Doctor, don't do the overthinking. I am saying this, if you are be anxious and you are doing the overthinking, you will getting your performance low, and then it will be not good for you and you will not give your 100% in the exam, so it's not good. Okay, so don't think about the last attempt what you did. Okay, but you remember all the silly mistake which you had in the last attempt. Okay, you know this mistakes which you did in the last time. Okay, जो last time जो mistake की थी वो mistakes नहीं करनी है. Just go and give your best, that's it. Don't think about the results and anything, and forget about the last attempt, what happened and what not. Okay, just don't repeat that silly mistake which you had in the last exam. Sir, my senior are saying कि वो भी देख के जाने की cause दोनों एग्जाम साइमल्टेनियसली होते हैं तो तब मैं भी या यू कैन सी आई कैन सेंड यू द PDFs ऑफ द नीट PG एग्जाम. ओके, so you can see that questions also, right? You can go with the questions of the NEET PG also. Okay, I will send you the PDF. I think already someone sent in the PDF in the group, and I will reshare again that PDF in the group, or you can ask in the group. Anyone will be share you this PDF. Okay, so you can go with the NEET PG exams questions also. Okay, anything else you want to ask? Again, I'm motivating you. Please be motivated. I'm damn sure all FMGs have that much potential. You can clear this exam easily. Just be motivated. Okay, just be motivated. I am trying my best. I did my best. I am doing well about the quizzes, about the image sessions, everything I did. Okay, just you have to do now, show your potential. Okay, what you did, you have to show this. It's your time. Okay, so do your best, give your 100%, and surely you will clear this exam. Clear? Okay, doctors, goodbye, best of luck. I am wishing you, okay, I am wishing you good luck for your exams which you have the tomorrow. Now revise the PYQs and revise the images at the last time, and if you have some volatile subject like pharma or medicine, so you can revise that one, fastly revise that, and okay, fastly revise that, and give your 100% tomorrow. Just remember my face. If you are forgetting any question, just remember my face and mark any option. Okay, 1, 2 or 3. Okay, and please don't forget one thing. Don't forget one thing. Okay, your target is 200 plus. That is the important thing, which is our motive, which is our main thing, which we had the name of our group. It's a target 200. So again, I'm asking you, please reply in the chat box. What is our target? Important thing. This is the important. It will give you some motivation, and when you are feeling depressed, when you are feeling anxious, when you are overthinking, just think about your dreams. Why you choose this medicine? Okay, why you came to this medical field? If you are thinking about this, surely you will get too much motivation. And think about your family, like your family members, everyone, your parents are waiting for your good results. So you have to give your 100%. So don't be anxious. Okay, don't be anxious, don't do overthinking, and give your best in the exam. Okay, right? And our target is, again I'm saying you, our target is 200 plus, so we will get more and more marks, again more than 200, right? I am waiting for your results and your exam. Okay, so I will message you in the group tomorrow 5 o'clock. Okay, when you are free from the exam, and then we will talk about your examination, how happened, well, what happened in your exams. Okay, be motivated. Okay, don't leave any question, attempt all the questions. If you are not getting the question, again you have to choose. Okay, you have to choose the answer. Okay, mark anything answer. Okay, A, B, C, mark, just you have to mark. Okay, clear? Be motivated. Okay, be confident, be motivated, think positive. Okay, don't think negative. Negative thoughts nahi hone chahiye mind mein. Be positive, be confident, and think positive. Okay guys, best of luck for your exams. I am waiting for your good results. I am waiting for your messages in my target 200 plus group that you cleared with the more score, more than 200 plus. Okay, I am waiting for your results. Okay guys, goodbye, good luck. I am wishing you again best of luck for your exams. You can do it, and you will do it. Okay guys, goodbye.